Governor Kate Brown's executive order will plunge Oregon back into wearing masks almost everywhere we gather inside other than our own homes. It's not a popular move in many circles, but public health doctors like Ann Loeffler with Multnomah County say it is exactly what is needed.
I'm thrilled that she's done this. I know this was a super hard decision. It took a lot of courage. Oregonians have actually been great at stepping up and doing the right thing, and they kind of are done being told what to do. This will make a big difference in slowing down the epidemic.
Part of what's driving the governor's decision is graphs like this. It's for Jackson and Josephine County, and it shows how many people are hospitalized from that area with COVID. The previous winter spike reached 69 people, but August 9th, it was 119. The statewide number doesn't look much better. The winter high point for hospitalizations in all of Oregon, that top line, was 662 in November before the vaccine. And now with the vaccine, August 9th has reached 592 people. Researchers at OHSU say we should expect the numbers to keep climbing and that by September 7th, if nothing changes, Oregon hospitals could run out of beds in a big way, ending up as much as 500 short.
We are seeing a drastic increase in patients hospitalized due to COVID-19.
Take a look at what they found in July. New cases for vaccinated people are on the bottom, unvaccinated are that top line. It's 6 times higher than the bottom line and heading almost straight up. Data scientist Peter Graven from OHSU crunched the numbers, and he worries it may keep going until Oregon reaches herd immunity, and that would mean a lot of sick people.
It's a sizable population in Oregon. I would say, we have about 1.2 million people who are still susceptible. If they all got infected at once, which is kind of what we're looking at right now, we do not have room for the share that need the hospital.
Let's hope that doesn't happen. Out live now, the hospital numbers for COVID really are eye-catching. As of this afternoon, 635 people hospitalized around the state. That's higher than the peak last November before we had the vaccines. And that has really got a lot of people concerned. Back to you.
So, Pat, a couple questions here. Why did it take the governor so long to do this? Why wait so long as we see those numbers increasing, but then act now?
Well, I think it's because when she announced on June 25th that the state was back open, I really think she just kind of wanted to wash her hands and be done with it, turn it over to the local leaders and let them handle little hot spots. Because, cases were really trending down and the daily reports were pretty minor and it kind of felt like we were all getting, on with our lives. But then as things started ramping up, she kept getting asked, shouldn't we be doing something statewide? And she would say, no, it's to the local leaders. But when you look around the state, there are local leaders who just did not take any action. Now, maybe that was their form of leadership, but nothing was happening. And the virus, of course, is not going to stay just in one county. Multnomah County started a mask mandate. Well, that's great, but that's not going to stop the spread. So I think when she started thinking about that and looking at these hospital numbers, she saw there was urgency for a statewide issue and something done, and that's why she acted.
All right, gotcha. And now, of course, so many people watching this wondering, how long are we going to be living under this new mask mandate?
Well, that is a great question. The data scientist was saying September 7th until we're at the middle of it. So it could be October, it could be November. When Multnomah County did it, they said it could be till January. This fifth wave is going to be big and it's going to be ugly and it's just getting going.
All right, thanks so much, Pat.